Good evening to you and welcome to tonight's lecture. My name is Joey Sherrod. I'm one of the pastors here at Signal Mountain Presbyterian Church, and we are so glad that you have made the time this evening to join us for what we think is an important conversation about this particular moment that we have been given right now. This is the second in a series of 3 lectures about Christian faith in the time of COVID. This particular moment that we have all experienced and shared, all the things that we have been through, and we have been through a lot, has placed on us a number of burdens and challenges. And even right now, as perhaps we have a growing sense of optimism about where we are headed right now, we do think it is important and significant to take some time to reflect about what we have learned, about how perhaps the things that we have experienced are important for you and for me, not just in times of crisis, but in all times where Jesus asks of us faithfulness. And so in this series of lectures, we're asking questions about what it looks like, the shape of Christian faithfulness, and how we can be obedient and faithful in all seasons. Our third lecture, which will be next Wednesday, we'll ask questions about the shape of our common life and how we can reimagine that, and how a number of inequalities have been exposed in this most recent season, and what it looks like to move forward in faithfulness and address those things. That lecture will be next Wednesday night, 7 p.m. Eastern, with Dr. Patrick Smith, and I'll put information about that in the comments as well, but we would love for you to join us for that. We also want to thank our sponsors for tonight's event, the Henry Center at Trinity Evangelical Divinity School and the John Templeton Foundation, who through the Creation Project have made possible what we get to enjoy tonight. And so we give thanks to them for what they're doing to further what we think are important conversations like the one we're having tonight. But it's our pleasure and our honor to welcome with us tonight Dr. Warren Kinghorn. Dr. Kinghorn, who is coming to us from Durham, North Carolina, has a number of positions at Duke Divinity School. He is an associate professor of pastoral and moral theology. He co-directs the Theology, Medicine, and Culture Institute, and also teaches psychiatry at Duke University Medical School as well. But is asking questions about Christian faithfulness, particularly as it relates to mental health as well. I know Warren, first of all, through worshiping with him at Blacknall Memorial Presbyterian Church, and it's a particular joy that there's a number of folks from Blacknall who are joining us tonight, and so we're glad that you would join us. And Warren in particular, we're glad that you are with us as well. So welcome. Warren will be speaking to us about Christian faith and mental health.
Great. Thank you so much, Joey. Can you all hear me and see me okay? Great. Thank you so much for being here tonight over Zoom. I realize that the vast majority of you who are here have been on Zoom a lot over the last year. And so thanks for taking an evening time in the spring to join in over Zoom. It's really my real pleasure to be here. And I'm actually incredibly happy to be the halftime entertainment of your 3-part series between Lydia Dugdale, who some of you who are in the Chattanooga area had a chance to meet with earlier this month, and then my Duke colleague, Patrick Smith, who's going to be speaking next Wednesday, I think, also over Zoom. And I have just intense respect for both of them, and so I'm really happy to be here in this role, so thank you. I want to share a few slides here. So let me share my screen. And just to welcome you into a conversation on COVID-19, mental health, and Christian faith. I also want to bring you greetings from the Duke Theology, Medicine, and Culture Initiative. I want to encourage you to connect to our work if you're at all interested in that, or if you're connected to healthcare. We are an initiative within Duke Divinity School that exists to bridge the world of healthcare and the world of Christian faith and practice. We invite, among other things, we invite healthcare practitioners and medical students and health trainees to come and study with us at Duke. But we also are starting a distance hybrid certificate program. It's a 6-course certificate that anyone can participate in and continue to live and work right where you are. And it involves studying in a seminary in the range of Christian theology and practice, also taking courses specific to the intersection of theology and healthcare, and participating in spiritual formation that's specific to the needs and work of healthcare practitioners. So if you're interested in that, I'd love to talk with you afterward or at some later time. First thing I wanted to do actually was to just get a pulse of the group. And so this is a QR code. If you have a smartphone near you, you can pull out your phone and take a picture of this, and it'll lead you to a website called Mentimeter. I also think that I might be able to post in the chat. Let's see, a link to the voting site, which you should be able to get to, as I've just posted it there. And then in just about 10 seconds, I'm going to go to the poll itself, and it's a word cloud. So I'm going to stop sharing this screen, and don't worry if you haven't gotten this yet, there'll be a way to connect to it later. It's a word cloud that asks the question, what are 3 feeling or emotion words that describe your experience of the COVID-19 pandemic? So take just a minute, either to, if you've already clicked on the QR code or that link that I posted in the chat, you can vote that way. If you haven't, go either on your browser if you're able, or on a smartphone to www.menti.com. And once you're there, menti.com, and then use the code 90213632. And once you've had a chance to answer, we should start seeing some words that begin to pop up here under this question. Yeah, thank you. We'll just take just a minute to give people a chance to answer. Just noting these words that are coming up. And as expected, there's a kind of variety of different kinds of words that are here. Seeing some words that are hopeful, I think is on here. Grateful, awestruck, quietness, fattening, I like that, I identify with that. And I see also a lot of other words that are kind of reflect difficulty and challenge. Here's another: appreciation for slower pace, that's helpful. I see words like grief and sadness, unproductive, certainly felt that, anxious, isolation, tired, hidden agenda. And then the 2 that are the most common in terms of how you responded are fear and grateful. I think that's such a lovely combination there. Thanks for keeping these coming in. It's great. Serene, disappointment. Yeah. This is really helpful because I think this reflects my experience of the pandemic so far. I think that there have been some blessings within it, and there have also been a lot of challenges. And I think that may be where we collectively are. I appreciate that. Thanks so much for letting these answers continue to come in. Anxious, fear, and grateful. I love how these are the 3 modal responses that multiple of you have submitted. And I also really appreciate all of these words here. Keep coming, it's great. Keep coming. Missing hugs and touch. I love that. It's one of the more recent ones. Pause. Relentless. Relentless is absolutely the case. Yes. Yeah. Thank you all very much. I'm going to stop sharing this. I'm happy to share it later on with any of you who'd like to have a copy of this. But thank you so much for for joining with me in this at the beginning here. I'm going to go again to share my a few slides here, away from the QR code this time. I think it's helpful in thinking about a lecture on the COVID-19 pandemic to think about like where we are in the pandemic, because thank God we're not where we were a year ago, and yet we're still in a pretty hard place. So this is from the Financial Times website. Many of you know their curves that they publish. This shows new confirmed cases, absolute number of new confirmed cases in the United States by week over a 7-day rolling average between January of last year and basically the present. And so this is one way to track like where we've been and where we are now in the pandemic. So on four dates that really kind of occur to me as important, and some of you may have other dates that you found to be important. One would be January the 21st, which was when the CDC confirmed the first COVID case in the US, and it began to be more in the headlines. Many of you remember February and early March of last year, there was increasing concern, but life was about the same for most of us. And then March 13th was when the president declared COVID-19 a national emergency. And right about March 13th was when a lot of things began to shut down, including the NBA season. Schools and colleges and universities began to close, and lockdown measures began to be put in place. That lasted for about a month, and then April 16th, the White House issued reopening guidelines, and then we began what I would consider maybe a protracted period between April of last year and arguably to the present, but certainly until late fall of last year, where there were no effective treatments for COVID. There was still active spread of COVID, but there was a lot of tension in our country and in our culture around like how we should respond, whether we should maintain strict distancing and lockdown measures, whether the economic and social costs of that outweighed the costs of infection from the pandemic. And this was a time of a different kind of anxiety, not only anxiety about catching COVID and COVID spreading, but also different kinds of tensions. And of course, end of May last year is when George Floyd was killed, when streets all over the United States were filled with protesters. And then since then, we've not only been engaging a kind of pandemic of COVID, but also a pandemic of awareness of racial violence and racism that's added additional kinds of stress. December 11th of last year is when the emergency use authorization for the Pfizer BioNTech vaccine was approved, and the Moderna vaccine about a week later. And since then, we've now been having increasing rates of vaccination in the United States. And you can see that there was an initial surge in the spring that was concentrated in New York, especially. There was an additional surge in the late summer, a huge surge in the late fall and early winter. And then now we're in this kind of protracted phase where on one hand, things are not as bad in terms of new cases as they were back, especially in early January. But neither are they consistently getting better. We can hope that this slight downturn at the end here actually is the beginning of a huge downturn to near zero, but we don't know that. In fact, the COVID case rates in the United States as a whole, and also in both Tennessee and North Carolina, where I am, have been pretty flat for the last month and a half, 2 months or so. And people think that that's because we have variants that are more contagious and are increasingly affecting younger adults. And also we have increasing numbers of people being vaccinated. And so that's kind of counteracting, but we're kind of a little bit stuck here. And I think it's important to be able to note that we are looking to the end of the pandemic, but we're not yet done with the pandemic. You know, we're not really on the other side of the pandemic, able to return to normal without looking back. We're still in this like uncomfortable middle space, looking forward to, in hope, to the end, but also very much in the middle. And this is, of course, our national story, but some of your personal stories look very different. You may think not so much that about the story of the pandemic in this way, but it might be marked by a series of before and afters. Before I got sick, life was one way. And since I got sick and have been dealing with symptoms of long COVID, my life is very different. It could be before the layoff or before this business closure and after the business closure, before she died and after she died. That's the way that a lot of people in our country, and no doubt some of us here in this meeting, have experienced the pandemic, not in terms of this kind of curve, but in terms of very clear and sometimes very devastating uh, uh, personal events. So we find ourselves in a space of hope and of grief, of longing for ways of life we've loved, and of not being sure that we'll ever know those ways of life again. And in some cases, we know that we won't know certain ways of life that we've known and loved again. Uh, and so where we are now reminds me a little bit of the book of Ezra in chapter 3. And you may remember Ezra's the story of the people of Israel returning from the exile in Babylon. They were finally, after being there for a couple of years, able to begin rebuilding the temple that had been destroyed by the Babylonians, the site where God dwelt that they thought could never be destroyed, and it was. And there's this poignant section at the end of Ezra 3. It says that all the people responded with a great shout and when they praised the Lord, because the foundation of the house of the Lord was laid. So they were happy. But many of the priests and Levites and heads of families, old people who'd seen the first house on its foundation, wept with a loud voice when they saw this house, though many shouted aloud for joy, so that the people could not distinguish the sound of the joyful shout from the sound of people's weeping, for the people shouted so loudly that the sound was heard far away. I love that. I love that because it's human. It's both the joy of return and the grief of what was lost. And it seems to me that that's in some ways where we are now, that it may be appropriate to have a time where the sounds of weeping are so intermingled with the sounds of joy that it's maybe sometimes hard to tell which is which. And this comes to the heart of what I'd like to offer in our time together. The COVID-19 pandemic has been devastating for many individuals, families, and communities, including some of you and certainly some of those whom we know and love. And I want to honor that. That said, our culture as a whole hasn't experienced the kind of radical loss of a way of life that Israel and Judah experienced in the exile, or that the early disciples of Jesus experienced in Jesus' crucifixion. But insofar as the pandemic has made us aware of how vulnerable we are and has exposed us to suffering and death and injustice in ways that are new and disturbing to us, we have a lot to learn from the Bible and from those who come before us in faith. So in this lecture, I'd like to discuss some ways that the pandemic is stretching us with specific regard to mental health questions and concerns. And then I'd like to think about some ways that our culture often responds, and then to consider 7 themes of Christian faith that I think can help us to know how to respond faithfully to the times that we're in. So let's step back from theology for just a moment and consider the COVID-19 pandemic from a mental health perspective. I'm a psychiatrist and I practice at the VA hospital here in Durham. I see patients, I've been working with patients through this, and I've certainly seen in my own practice and in my own life and in my own community ways that COVID-19 has taken a significant mental health toll. A couple of important points of context is that a huge number of Americans were already struggling with mental health problems and concerns even before the pandemic. And so here's a slightly dated 3 or 4 years old slide that just shows the prevalence estimates of major depression, or specifically of a major depressive episode among adults in the US. And you can see here that over the past 12 months in 2017, 8.7% of women and 5.3% of men, for about 7% overall, or that's about 1 out of 12 or 13 people, had experienced an episode of major depression, which is a pretty significant life event. And that's a huge number of people in our country and in every community, including at Signal Presbyterian and including at Blacknell Presbyterian and in any of our churches. And you can see here that the prevalence was higher among young adults ages 18 to 25. I keep telling my students at the divinity school that I think that 25 is among the hardest ages to be actually right now in the United States. And it decreased some with older ages. And then had some racial and ethnic variation, and we'll come to some of that later. But these are high numbers already. It's not like things were great for a lot of people before the pandemic. Here's another slide that showed that in, I believe this is in 2015 or so, that 20.2 million adults ages 18 or older live with substance use disorders, and majority of these with alcohol use, but also with other kinds of substance use disorders. Here's a prevalence rate of any mental disorder diagnosis among adults in the U.S. And again, the estimate here in 2017 is that 22% of women and 15% of men, that's about 1 in 4, 1 in 5 women, and 1 in 6 or 7 men experienced some form of mental illness. So again, a lot of distress is already present with us, and COVID-19 pandemic just is added on top of that. And this is an alarming slide here that shows, again, before the pandemic, that the population adjusted, the national annual rate of death by suicide has been increasing, or I should say increased year over year between 1999 and 2018. Thank God, and I'll talk about this in a minute, the rate has begun to inch down a little bit from 2018 to 19 and 2019 to 2020. But we're seeing not just increased numbers of deaths by suicide, but also increased rates of suicide. And that signals things that are happening in our culture where people, in part, it's related to people in a culture where is hope and how are we connected to each other? And we'll talk about that as we move on today. So all that to say, there was a lot happening before the pandemic. And in the pandemic, there's plenty of data that shows that stress has increased. I would say that from a research perspective, getting mental health data from any major event like a pandemic is hard to do, in part because the measurement is hard, and also in part because sometimes the data takes a while to come in. And so we're still collecting information. And I would say that the evidence is mixed at this point, and there's maybe some possibly surprising findings. One of the good things that I said just a minute ago is that contrary to people's worst fears when the pandemic first started, there wasn't an increase last year in the rate of suicide in the United States. Matter of fact, the rate went down a bit. There were a total of 44,834 documented deaths by suicide in the US in 2020 and 47,511 in 2019. So that's good. At the same time, that's still a huge number of people who died. And so the fact that it has gone down a little bit is a cause for, in one case, it's a cause for being relieved, but still it's an enormous problem. And at the same time, maybe counteracting that, and in part because of how things are measured, the rate of overdose deaths of substance, especially opioid overdoses, increased nearly 40% from the year ending June 2019 to the year ending May 2020. There were over 81,000 deaths by drug overdose in the United States last year, and that number has never been higher. That is in part because of the use of synthetic opioids like fentanyl as substances of abuse, but it also is, the rate seemed to increase from March to May of last year, and we're awaiting more current data. There's been other kinds of data through the COVID pandemic. There was a survey from June 24th to 30th, 2020, that showed that in that study that 41% of respondents reported at least one adverse mental or behavioral health condition. 31% reported an anxiety disorder or depressive disorder. 1 in 4 reported a trauma or stressor-related disorder. 13% reported having started or increased substance use to cope with stress or emotions related to COVID-19. And 1 in 10 Americans reported that they had seriously considered suicide in the 30 days before completing the survey. And this was higher among younger adults, in which it was about 1 in 4 adults, higher among racial and ethnic minority groups, higher among unpaid caregivers for adults, and higher among essential workers. Again, this was right at the beginning of the pandemic. And these rates of depression and anxiety were far higher in this period of time than they were a year earlier. And then there's been other studies that have shown this consistently. I do want to report on one study that just showed up a couple of weeks ago from the CDC that reported that, if anything, that as the pandemic has gone on, and this shows, this is from something called the Household Pulse Survey. That's a kind of very kind of brief and quickly reported survey of American households, that it looks like these trends have actually intensified at least somewhat over the 6-month period between August of 2020 and early February of 2021. You see here, these are the solid line is symptoms of an anxiety or depressive disorder, and then it's broken down by anxiety and depression. But you can see here that on the whole, at least, things are not getting better, and they seem to have gotten a bit worse over the 6-month period. And that, I think, confirms what a lot of us have experienced and are experiencing. Another thing I would say, just from a mental health perspective, is that major social stressors, like the 9/11 bombings, for example, or living in a war zone, or a pandemic, although we're still seeing how this is going to respond, tend to have mental health consequences that last for a long time. There's a long tail to these events where after the case rates have gone down, after everything is reopened, there will still be mental health challenges and suffering as a result of COVID that may go unnoticed because everybody else is kind of, up and going. But this is going to continue to be with us for a long time. So why is this the case? I think most people can agree, regardless of some of the mixed data, most people can agree that COVID has delivered just an enormous amount of additional stress to nearly everybody, and to some much more than others. To name a few possible kinds of stress, on one, there's contagion stress. So this would be anxiety about contracting COVID-19 and the subsequent health outcomes that are associated with COVID-19. And this is a significant thing. And it's also hard when the kind of things that used to be easy in life, like going to a grocery store or going to church or gathering with people or other things, all of a sudden then become sources of stress because of the possibility of COVID spreading. So that's one kind of stress. Another kind of stress that is significant is caregiver stress. And this would be, this could happen on a number of levels. So one thing that has been widely reported, and I think I've certainly seen it and felt it to some extent, but also have certainly seen it in colleagues and seen it in the literature, is that the kind of cumulative stress on healthcare practitioners and clinicians, especially those that are on the front line of delivering care to patients who are sick with COVID, but also to those who are just working in systems that have been kind of high alert for the last year, is significant and cumulative. And I think there are many testimonials by now of nurses and of physicians and respiratory therapists and others who have been working in intensive care settings for months and months and months, seeing death after death after death, seeing people on ventilators, sometimes seeing them leave and weakened, and sometimes seeing deaths. And the stress of that continues to accumulate. So that's one kind of caregiver stress. And there's also the kind of stress and the social isolation of caregivers of those with COVID who have to be quarantined, and of those who are recovering from COVID. So some people, as we know, have lingering problems related to autonomic function, related to exercise tolerance, to ability to breathe, after they've tested negative for COVID, after having COVID. Another kind of stress that's on us and feels significant is economic stress. This would be, of course, from underemployment or unemployment. It may be related to housing or to evictions. And so one thing that we certainly see is that those that are unable to pay rent are under additional kinds of stress, but also a lot of landlords now and people who are in stress because they're not being paid or because they're stuck in different ways and they have bills due. And so you see this kind of accumulate in a number of different ways. There's economic stress from health-related expenses, including expenses that come from having long-haul COVID and inability to go back to work. There's childcare burden and expenses with schools not meeting in person. So all of these are significant kinds of economic stress. Then you have, related to that, stress of social isolation. I'll say this over and over again in the context of this talk, but it's we're fundamentally not made to be completely separate and distanced from other people. I think many in the pandemic have found ways to make meaningful connections, but some haven't, and so it's intensified sense of loneliness among many. And I think for all of the necessity of churches not meeting in person, and for schools, at least for a time, not meeting in person, and for large gatherings not being possible, The pandemic has taken away much of the kind of capacity for just sharing meals together and sharing space together and having kind of unhurried time together that often is a way to help us kind of buffer us psychologically. And so that's something that I think just cumulatively added to stress over time. There's of course families have been sometimes separated, maybe across borders or maybe by just the necessity not to visit, and that's getting now better now that people are having vaccines in some cases. And there's of course the stress of those that are in skilled nursing facilities or in hospitals. Some hospitals and nursing facilities are now relaxing some of their visitation policies, but there are people now in skilled nursing facilities in Durham, and I'm assuming also probably in Tennessee, who have had, apart from staff, who've had very little very few outside visitors for the last year, and that certainly has a long, kind of a long cost associated with it. And then finally, there's relational stress. I know I'm talking about a lot of different kinds of stress. I think that that there's no family, there's no church, there's no community in the United States, probably in the world, that's not in some way experienced some kind of stress related to the pandemic. And one of I think the losses of the pandemic is that places of solace, like family rituals and routines that have been in most times ways of like escape and joy, have become the very site of stress. So a lot of families have experienced real divisions about mask wearing and about who's going to visit at holidays and when is it okay to travel. And so these like desire to see family can sometimes like intensify stress in families. In a different way, in a different key, I think there's also the real concern that maybe getting a little bit better now that people are out more. But at a time when most people were really at home and had very little other place to go, there's real concern about intimate partner violence, about childhood abuse. In our area, there were fewer referrals to the foster care system than there had been in the year earlier, and that was a real concern that that schools, especially, may not be knowing what was happening to children. And so these are all kinds of things that we've experienced. And then I think just increasing pressure on leaders of organizations. There's no pastor, there's no school principal, there's no school teacher that has not in some way felt a kind of just stress from figuring out solutions to problems that they never had imagined would exist 2 years before. And for many who are in leadership positions, this has been going on now for 13, 14, 15 months and hasn't yet stopped. So that's a lot of stress. And I think that's just names, I think, some of the kind of things under the pot. We're going to talk about how Christian faith might be a way to respond to some of this. But I do want to mention before that a book that I've actually found really helpful. It's not written by a Christian author. Johan Hari is a journalist in the UK. But I find that this book has been really helpful for me thinking as a psychiatrist about the work that I do. So Hari is a journalist who himself was depressed, who sought care within the National Health Service in England, and who came to appreciate the way that depression was embodied, that there were things happening in the brain with regard to depression. But he began to feel that the kind of highly medicalized treatment, basically just medications without any therapy, that he was offered was effective and helpful. And he began to wonder about his experience in depression and anxiety. And he really writes about the two together, saying that they can't ever be entirely disentangled from each other. And he says, what if the epidemic of depression and anxiety in our culture is not because humans as a whole were becoming more vulnerable or because something was changing in our brain circuits apart from anything else, but what if it's that we now live in a culture that no longer effectively meets basic human psychological needs? What if we're made for connection, and if we live in a culture that increasingly is characterized by forms of disconnection, and if depression and anxiety are in some ways responses to that experience of disconnection? And he's a journalist. He writes kind of anecdotally about different strains of research, but he has different chapters where he says, what if we think about depression and anxiety as a phenomenon of disconnection from meaningful work, from other people, from meaningful values, from childhood trauma, from status and respect, from the natural world, from a hopeful or secure future? What if we were to think about depression, anxiety in those ways? And then what if our primary response to depression or to anxiety is, of course, to seek medical treatment as necessary, to get therapy, to do those things, but also to think about how can these things that are disconnected be reconnected? Hari's book came out well before the pandemic. He's not writing in the context of COVID, but it does strike me that the pandemic has made certain kinds of connections much more difficult, especially connections with other people, but also meaningful work, also in some cases status and respect, also a hopeful or secure future. Some people have actually turned to the natural world during the pandemic as a place of solace, and I think that that's appropriate. But how do we see us living in a culture that was already disconnected, that has become even more disconnected in the context of the pandemic, not just the COVID virus, but all of our responses to it? And I think that a lot of our political tension and problems in our culture over the last year has been in part people like hungry, crying out for connection of some sort. And sometimes people find healthy forms of connection, and sometimes people find unhealthy forms of connection. And yet we're being to fundamentally seek out others in those ways. So I want to turn to a few ways that people have often responded to pandemic stress in our culture over the last year. And then I want to turn to specifically to scripture and to Christian faith, think about how might we think about responding in a healthy way. I'll be fairly brief about this, but I want to argue that there's three common ways that people often respond to pandemic stress. One, I think, is denial. And this would be just, basically just saying that this is not a problem for us, that the virus isn't serious, it's just a flu. It would be avoiding or chafing against any kind of mitigation measures like wearing masks or social distancing or other things. And I, in this talk, I don't particularly want to be political, and I'm not trying to get into the details of it, but I think that's a pretty unhelpful response, not just because it puts us, who are those who deny, at risk, but also it puts others who are vulnerable at risk of COVID and of other kinds of adverse effects. And so that's not particularly effective. Another kind of response, though, is despair. And that's not quite denial. It's not denying that the pandemic is serious, but it's basically the attitude of like, well, if I'm going to get sick, I'm going to get sick. There's really nothing to do about it. What'll happen will happen. And this can actually sometimes lead to some of the same responses that can happen with minimization or denial. It's like, well, why wear a mask? Why take care to stay socially distanced? Why do these things anyway? Because what's going to happen is going to happen. And I would argue that that's not a helpful response. We can talk more about that in the Q&A. Another, though, that I'm guessing hits certainly closer to home for me, and I'm guessing it might also hit closer to home for some of you, would be a third set of responses, which I might call practices of technical control. And this is the kind of thing that I actually find pretty appealing, not just because I'm a physician and kind of trained in modes of technical control, but because I think that I, in some ways, believe in this. And practices of technical control would be the idea that we can, through our own efforts, bring this pandemic under control. If we just have the right policies, if we just have the right technologies like antiviral treatments and vaccines, and if we just have the right public health measures in place, like we can do this. And we can do this through organization and through policy and through rules, and we can do it. And to be sure, this is a big step up from denial and despair. I support the public health measures that are in place. I wear a mask when I'm in public. I do the things that we're told to do by public health authorities to keep the spread of the pandemic under control for reasons that I've been talking about and will continue to talk about. But I think it's important to know that as Christians, there are pitfalls to this also. That if we believe that we can fundamentally save ourselves through public health measures, that it's all up to us, we just have to try harder, get the right policies in place. One is that it leads us to demonize those who, for various reasons, reject these measures. It leads to a kind of self-righteousness that, like, I'm the one who knows, I'm the one who has it figured out. Other people are clueless or they're just wrong. And so it puts us up in this place of judgment over others. That's one thing that can happen. But also, in general, in life, if we believe that we have been delivered, that we have been saved or could be saved through various kinds of practices of control that we control, then we're going to give a lot of power and give a lot of authority to whatever or whomever we believe has brought us to that place of control. which the Bible would call idolatry. To put anything in a place of sort of absolute authority over us, as if that thing can save us, and is a way to find ourselves participating in some form of idolatry that ultimately is going to distract us from love of God and love of others. And also, we may, if we get so focused on like we can do this, we may forget to mourn those ways, those things that we can't control. We may forget to mourn what we've lost. We may forget to be in a place where suddenly it's clear that as much as we might try, a loved one may still get COVID, may still die. Things may happen, and I think if we believe that we can control ourselves, then we make it more difficult to show and to express and to feel that kind of grace. So those are three ways that our culture has responded to COVID that I argue might not be as helpful or effective. So I want to close now with 7 resources from Christian faith for responding in healthy ways to the COVID-19 pandemic. And here I'm going to offer some resources, and then I really look forward to the Q&A where we can talk further and to hear your questions and to continue in conversation together. The first resource is lament. I mentioned that our culture is often turned to denial, despair, or practices of control to respond to the pandemic. I think that Scripture, learning from the example of the people of Israel and the early Christians, calls us to have a slightly different posture. The Christian response to overwhelming suffering is not despair or hopelessness, nor is it to take all of the problem on ourselves, seeking immediate control. It is rather to carry our suffering, even to carry our perceived futility, to God in a way that we locate our responses to that suffering within God's covenant faithfulness, and we locate our work in God's work. So I talk about this psalm with my patients. I certainly have, it's meant deeply a lot to me in my own life. Psalm 13 is an example of a psalm of lament. And I love this psalm for several reasons, but I'll read the first and last parts of it. How long, O Lord, will you forget me forever? How long will you hide your face from me? How long must I bear pain in my soul and have sorrow in my heart all day long? How long shall my enemy be exalted over me? And then the psalmist keeps going on, my enemies will overtake me, give light to my eyes, or I'll sleep in death. And it's important to know that in this psalm, the psalmist is crying out to God, like, how long? When will you show up? And God never appears in the psalmist's present experience in this psalm. The psalmist never in this psalm sees deliverance. But the last 2 verses of this brief psalm take a different tone. But I trusted in your steadfast love. My heart shall rejoice in your salvation. I will sing to the Lord because he has dealt bountifully with me. And I love that because the psalmist is in the present, crying, how long, O Lord? And yet the psalmist is able to look back. Notice how the tenses change here. I trusted in your steadfast love. He has dealt bountifully with me. The psalmist can look back at God's covenant faithfulness to Israel and to the psalmist. God is the one who rescued Israel from Egypt and who has called Israel his own people. And on the basis of that, of God's faithfulness, the psalmist is able to say, my heart shall rejoice in your salvation. I will sing to the Lord. So the psalmist deals with the present by looking to the past and God's faithfulness in the past to hope into the future, even though the deliverance is not yet present in the psalmist's experience. I think we can learn a lot from lament. It allows us to take the moment that we're in and not to deny the sadness of this time or the exhaustion of this time or the relentlessness, as one of you said, at this time, but rather to carry that to God and to know that God hears and God feels and God understands, and with God, to participate with God in the work of healing and restoration. The second resource is what I'll call solidarity. Here's the last 2. I gave a lot of slides and statistics earlier. These are probably the last 2 that I'm going to do, but I want to point this out. Here's also from the CDC website, and this is a generated graph of excess deaths in the United States in the year 2020. This actually shows 2017 to 2020. And you can see here that that typically numbers of deaths in the U.S. by week typically follow a pattern where there's a bit more death in the winter time than there is in the summertime, and that's because of seasonal illnesses, especially influenza. You can see that there was a peak that actually went over the expected curve in the beginning of 2018, presumably due to a bad flu season. But you can see this dramatic change of excess deaths in the US in 2020. And these data here are still incomplete at the end here, so don't wait too much into the last few weeks. But you can see that, that they've divided it. So the blue here is excess deaths that are known to be caused by COVID. And then the green is everything else. And so even there's some, this may be because COVID is undercounted or because COVID has led people, maybe because of stress, to have other kinds of causes of death. But we've seen several 100,000 excess deaths in the US over the last year. So that's a huge tragedy itself. But now look at this graph that is I just calculated it in a different way. This is now broken down in 2020 by racial and ethnic census categories. And so here's the category. So this is both the percentage difference over the numbers of expected deaths per week, and then here's the absolute number difference of the numbers of expected deaths per week. Most of the US is white, and so it's not surprising that that in most weeks the highest numbers of deaths were among white Americans. But look at this percentage category here. So you can see here that the death curve for non-Hispanic white Americans roughly is the same shape as the curve of the pandemic as a whole. And this is a huge tragedy here. Every bit of one of these lines is a loved one of a family that's now grieving someone who was here and now they're not because of COVID-19. And so this is significant. But look how disproportionately the burden of death has been borne in the US over the last year by communities of color. Here's the increase in percentage, the percentage increase in deaths by week of 2020 among non-Hispanic Black Americans relative to white Americans. Here's the curve for Hispanic Americans. Here's the curve for non-Hispanic Asian Americans. Here's the curve, slightly different shape for American Indians and Alaskan Natives. And then there's a curve for folks who don't, or in other categories as well. And you can see here that this is in no way, if COVID were no respecter of ethnicity or race, then these curves would all be the same size, but they're not. They're vastly different. And I think it's important to just note that I'm guessing, I can't see you on the chart, but I'm guessing most of the attendees of this lecture are probably white. And COVID has been significant in white communities, but it has been much more, has a higher lethality and higher morbidity rate, higher infection rate in Black and Hispanic and Asian and Native American communities. And I think it's important for us to note that. And so in our area, Durham is pretty racially diverse, and in our area, I find that people in the Black community have almost always by now have had first-degree family members or people in their churches or communities that they've known have gotten COVID and become sick with COVID and who've died. And that's less likely to be the case among the people that are the white colleagues and friends and people that I'm directly connected to. And I think that's probably inversely related also to the way in which a lot of white Americans have said, well, like, it's not so bad because it's not affecting us that much. But in our very communities, it's affecting others much more. So I just want to say this is a Christian issue and not just a public health issue. There's many factors that contribute to this, but it's not like biological genetic factors. It's things like housing, like density of housing, people living in multi-generational housing, it's patterns of employment, it's access to healthcare, it's existing burdens of disease. And that's not to mention that the attention to racial violence in our culture has just been compounded onto this. And so that's also been borne, the stress of that has been borne disproportionately by communities of color. So I know that it's tempting for us now, especially when we're longing for the end of the pandemic to be like, I just want all this to be over. I don't want to, have to worry about the pandemic anymore. But I think that as Christians, we we're doing these things related to the pandemic. We're looking out for the good, not just of ourselves and our immediate families, but also for all of those in our communities, including Christians, other churches and Christian communities in our area. And I just want to say that I think that this is consistent with the way that we think about Jesus as a healer. And I want to just briefly argue that there's three ways that we can think about Jesus' healing ministry. Uh, and if you look in the Gospels, then all of these things are operating throughout the healing narratives, and almost all of the examples of Jesus healing. Here's an ancient painting of the healing of the woman with the flow of blood. You see these three things in place. One is what we often think of as healing, as reversal of disorder and decay. That's what I kind of think of as a doctor. It's very common to think about healing as reversing a disease process. Of course, when Jesus raised Lazarus, that was an ultimate example of that. But when Jesus healed, he also was involved in rescue from hostile and oppressive powers. You see this perhaps most paradigmatically in the way that he casts out unclean spirits or demons, that he heals legion of the spirits that are with him. And sometimes these forces, these spirits, have socio-political dimensions. I'm glad to talk more about in the Q&A. And he also is engaged in restoration to relationship and community. So it's very rare that you find Jesus healing a disease without also rescuing someone from oppressive and hostile powers and restoring them to right relationship in their community. And so in the case of the woman with the flow of blood, you see this where Jesus not only heals the woman's flow of blood, but also restores her to her community where she had previously been stigmatized and ostracized. So as we think about healing from COVID-19, how can we be those who are modeling all three dimensions of Jesus' healing? Next is gratitude. 1 Thessalonians 5:16 through 18 says, "Rejoice always, pray without ceasing, in everything give thanks, for this is the will of God in Christ Jesus for you." And I would say this was and is written to a community that was under a lot of stress. And this we see within modern research psychology, that gratitude is increasingly recognized as a core component of flourishing and of resilience. And so if you know psychology, you'll know that there's frequent prescriptions for making gratitude lists and checklists. I think also this is just a natural part. It's a gift of what it means to be Christian, that sometimes in the broader world of psychology, people are grateful, but they're not quite sure exactly to whom they're grateful or how to frame that gratitude. But we know exactly who we're grateful for. We're grateful to God as the source and giver of all good things. And so we're able then to notice the goodness of creation, to notice the goodness and beauty of others, to be grateful for what is, even as we lament and mourn what isn't. And so I'd just ask us to consider, what are the gifts that we've received amid the pandemic, even when things have been hard? And I would encourage you, if you're not doing this, to take a few minutes after this lecture or tomorrow morning to write down in a prayer those things and people for whom you're grateful. And that can be done not as a way to efface that things are hard, but to be able to notice what the gifts that are around us, even when things are hard. Next is grace. The pandemic has increased stress for nearly everyone. And I have this non-scientific perception that everything in the pandemic has been about 30% harder than it was before. Going to work, going to school, certainly going to church services. It's all it takes a bit extra effort for a lot of different and sometimes unquantifiable reasons. And so for many of us who are kind of used to being kind of productive and efficient and hard workers, we kind of compensate for that by just working harder and more until we reach a breaking point. But I think it's important to note that we are not superhuman beings. We're not machines that you can just kind of keep, putting premium gasoline in, but we are embodied creatures with real needs and limits. And our faith teaches us, and this is probably the most important thing I'll say tonight, that the deepest truth of who we are is not our education, not our productivity, not our ability to make money, not our ability to provide and care for others. It's rather that we are known and loved by God, and that's enough. And so what does it mean to give and to receive grace for ourselves and for others? I think in part it means caring for our bodies, taking time to sleep, taking time to exercise, to engage in healthy practices that care for our bodies and in the right ways. It also means caring for and receiving care from each other. And I think it also might mean like limiting the way that we're constantly exposing ourselves through media to the chaos and disruption all around us. What does it mean to focus on the gifts that are right around us? Next is communion. If the pandemic has taught us anything, it's that we were not created to be alone. We weren't created to be disconnected from each other, as necessary as physical distancing has been for all of us. We were created rather for connection, connection to God, connection to the creation, connection to each other. Romans 12:5 says we're members one of another. And so in this in-between time, when we're hoping for the future and yet the pandemic's still with us, I think the question for us is, what does connection and communion look like now, not only during the pandemic, but also after the pandemic? I think we have a chance to think about what does it mean to cultivate communities that are where people are connected to each other. And I think it's important also to note that many people were disconnected before the pandemic. For some people, church as usual didn't work before the pandemic. There were real problems before the pandemic. And so what does it mean after the pandemic to be places where various kinds of ways that people have been disconnected can be connected, especially to meaningful work and to other people and to meaningful values and to status and respect, to the natural world, to hopeful and secure future, and of course to childhood trauma also. I think if we want to think about how to imagine what it might mean to do church after the pandemic, it might not be like just like before, but it might be to say, in what ways have people found connection during the pandemic? What have we learned about how connection happens? And how can we continue to foster forms of healthy connection, even when we're no longer asked by public health authorities to maintain certain kinds of distancing practices? The next and next to last resource that I'll mention is humility. The last year has taught many of us that we're more vulnerable than we had thought. We recognize that our bodies and our health is vulnerable, our ways of life are vulnerable, our cities are vulnerable, our democracy is vulnerable, and this is scary, and we can admit that. But it's also a gift because fundamentally, as human beings, we are vulnerable. We're Adam, we're creatures of dust. And so acknowledging our vulnerability in this time, to the extent that we recognize that we actually can't control our lives, actually brings us closer to the experience of the people of Israel, including those who returned from the exile and wept at when the temple foundations were laid. It brings us closer to the experience of the disciples at the cross. It brings us closer to the way in which those who wrote the Bible and who lived in the time of the Bible would have always known that they were always vulnerable to war or famine or plague or many other things. And so to the extent that we now feel that, we have the gift of in some way sharing life with them. And so what would it mean from that place of vulnerability, for instance, to pray Psalm 91 that says that you who live in the shelter of the Most High, who abide in the shadow of the Almighty, will say to the Lord, my refuge and my fortress, my God in whom I trust. For he will deliver you from the snare of the fowler and from the deadly pestilence. He will cover you with his pinions, and under his wings you will find refuge. His faithfulness is a shield and buckler. You will not fear the terror of the night, or the arrow that flies by day, or the pestilence that stalks in darkness, or the destruction that wastes at noonday. What would it mean to pray the Psalms in a way that we really can lean into the vulnerability that the pandemic has exposed for us? And then finally, we have hope. In my theological work, I draw a lot on the work of St. Thomas Aquinas, who has a way of following Aristotle, but putting it in a Christian frame, as a way of describing hope as a virtue, as a disposition that God gives, that is the midway point between two vices, two ways that lead not to flourishing, but to sin and to us not achieving our fullness. And those two vices are despair, that I've already mentioned before, the idea that no matter what we do, that we can't actually achieve the good life that God has for us, And on the other side is presumption, the belief that by our own efforts, or that we've already attained it, it's easy to attain. And hope is the capacity to rest in a good future that God will bring about, engaging us, but in a way that doesn't ultimately depend on us, because God is good and God is faithful. And I'd argue that these 6 other resources of lament and solidarity and gratitude and grace and connection and humility drive us, they lead us, they beckon us to hope. And it's that kind of hope, I think, in this point of the pandemic, over a year in, that we need to cling to right now. Romans 8:24 says, "In hope we were saved." But that Greek word that is translated saved could also be translated in hope we were healed. And I'll leave you with that. Thank you so much for spending this time over Zoom tonight and for attending this lecture. And I really look forward to the questions and conversation to follow.
Thank you, Warren. And I'm not quite as skilled as you are in Zoom yet. So I'm going to ask you some questions off screen. But and do friends who have joined us, do take a look at that Q&A box. And I've got some questions for Warren, but I'd love to hear from you guys as well in this. Warren, I guess one question I would have for you that we've been thinking about in terms of our own sort of pastoral leadership at this congregation, and I'm sure others are thinking about in various leadership roles, is what it looks like to shepherd people through kind of 2 things simultaneously. I think on the one hand, like, I'm not sure if trauma is exactly the right word to use, but certainly a shared, catastrophic experience that we've all had in the pandemic that sort of continues to need to be grieved and processed. But then on the other hand, to kind of also shepherd people sort of back into our common life together in the midst of, I think it's been probably a common experience for people who, even after they've kind of cleared their second vaccination, to have a real hesitancy to sort of re-enter something that looked like life pre-COVID. And I just wonder, from your own experience and thoughts, like maybe for both of those kinds of shepherding, like how we would think about that together.
Yeah, I think the question of return is really important. And I've been feeling this in myself, because we tend to lean on what's familiar, I think. And over a year, things that had been unfamiliar all of a sudden feel pretty familiar. Like we kind of get into certain ways of thinking and ways of life, like not shaking hands and not hugging and not being too close to people, that I think the idea of actually re-entering what previously was known to us actually can feel pretty scary, even after it's mostly likely to be fine. And so I think that's something that is there. I heard a member of our church last week give a talk, and I thought it was really wise. And she works with adolescents, and she said that we anticipated that adolescents would need a lot of care when the lockdowns first started because of distancing. But what we didn't anticipate quite as much is that adolescents would also need a lot of care in terms of the process of now re-entering a life of a lot of connection with other people. There's a lot of anxiety associated with that. And I'm a parent of children, and I certainly understand that a lot. And I think that makes sense. So I think in terms of the shepherding, I think one thing to note, as I said in the talk, is that it's important not for any of us in any capacity, not to think that that like all we need to do is get back to where we were before, because there are actually some people that have actually, a minority of people who are actually better served in terms of church and in terms of connection, in terms of school over the last year than they were before. And I think about parents with kids on the autism spectrum, or in some cases, or kids with a huge amount of social anxiety, or with or in other cases where actually having more flexibility to be outside for worship, or to be at homes, might actually have been a blessing in some ways. And so I think the process of shepherding, I think, is now discerning in communities, like, what does it mean given what we know about what we've lost, and also about some of the ways, some of the things we've learned over the last year, what does it now mean to cultivate the kind of communities that people can be and feel connected to each other? And I think that's a really challenging task, in part because like after working so hard, I think every leader is just like, I just need a break from having to think about this. Let's just go back to pull out the 2019, routine and like let's just go back there. And I think that we're not going to go back there. I think it's going to be a process of adjustment. I also think there's some anxiety because no church and really no voluntary community really knows what things are going to look like once everything is back. Who's going to be in the pews and who's not going to be, and what are people how are people naturally going to respond to invitations to gather? I think we don't know that. So I think it's just a process of constantly just recognizing that we just have to live in a space of realizing that we're not in control, and so making judgments along the way as best we can, and leaning on each other to do that.
Thanks, Warren. I appreciate that. I've got a question from my colleague here, Andy Cornett, who's asking about how do we help those who are perhaps instinctively resistant to the practice of lament for various reasons, because of like a sense that optimism is the best option, or fear of being honest, or maybe sort of a disconnection. Like, how do we sort of lead people into lament?
Yeah, I think lament can be hard because it feels like we're somehow being unfaithful if we're really honest with God about how we feel, that God will somehow judge us for that. And I would just say that's why the Psalms are such a gift, to have the capacity to just right there in Scripture. And so I think if we ourselves don't feel like we can kind of voice our own laments, then what does it mean to read through the Psalms and to notice how the Psalms help us shape our prayers, how to shape our ways of speaking? And this was the case for me when I first really started to engage the Psalms of Lament, and it's certainly been the case for a lot of students over the years. Just have no idea that the Psalms have as much range as they do, because we tend to focus on the Psalms of hope. So just last night in a class at the Divinity School, I read Psalm 120 and Psalm 121 back to back, and they're both Psalms of ascent. Psalm 121 is, of course, deeply familiar. I'm going to look it up real quick. Psalm 121 is familiar to all of us because it's, I lift up mine eyes to the hills. Where does my help come? My help comes from the Lord who made heaven and earth. I've known that by memory for a long time. But if you just look at the very verses before that in Psalm 120, also a song of ascents, the psalmist is saying, woe is me that I'm an alien in Meshech, that I must live among the tents of Kedar. Those were places that were a long way away from Palestine. Too long have I had my dwelling among those who hate peace. I am for peace, but when I speak, they are for war. And that's the end of the psalm. That's what we get. And I think that just allowing the Psalms just to shape our ways of thinking. So if it's good enough for the Bible, it ought to be good enough for us to at least be free to be able to go there, and to know that like it's there for a reason. Like God welcomes that. He wants us actually to be able to bring our wholehearted fears and lack of knowing and lack of control to Him, and He's faithful with that. And that's been just incredibly freeing for me in my own prayer life and in walking with others, to be able to really lean into that.
That's fantastic. That's certainly helpful for thinking about practices of Christian worship. And yeah, thanks for that, Warren. Yeah, I would just be curious, as you mentioned the book by Jonathan Hari, what in your own sort of experience as you've watched the pandemic unfold has been particularly revealing for you in terms of the ways that most modern people's lives kind of play out, makes connection really difficult for people. And what sort of steps could we take forward on the other side of this to build better environments for connection for people in our churches or in our communities?
Yeah. It's a great question. I think that Hari, as I said, I don't agree with everything that Hari says in that book, and he makes clear that he's not a Christian, so I don't want to endorse it fully in everything he says, but I think that his point about that we are fundamentally affected by these kinds of disconnection in our culture is something that I really take seriously. And I think of mental health challenges in general. We always have to think about them in two different ways at the same time. We have to think of them as internal problems that, like problems with, it certainly can be problems with brain chemistry or other things that then show up in the world of relationships and community. But they can also be external problems of relationship or of community, of culture that then show up inside our bodies. I like to think of that as an inside out approach and an outside in approach. And it's always important for us to always think about both approaches and think which fits better. And I think with a lot of depression and a lot of anxiety among my patients and among, in our community, I think that there's inside out contributions, but there's also a lot of things in the world that I think are leading people to feel that way. And that's where I find Hari as a journalist really helpful. I think that there's a lot of different ways to answer that, but I think that people deeply on both a biological and a psychological and a spiritual level need to know and to be known. And I think that the way in which we organize our communities in ways that people can genuinely do that are really deeply important. So somebody can be packed in with other people in a church service on a Sunday morning, but if at no point in that time they ever have the experience of being seen and known, then it might have some benefit just from being proximate to other people, but there's going to be a kind of human need that's not met. So what does it mean for everyone in any of our sanctuaries when we're there again on a Sunday morning to have some experience, even a brief experience of being known? And I think that also applies to social media. So I was just in a conversation last week with a psychologist who does research on adolescence and social media, and she basically said social media use, the more adolescents who use social media for many hours a day tend to have worse mental health outcomes than those who use it for fewer hours a day. So some social media use is not typically bad for health, but a lot is. But it really matters how you use social media. And so adolescents who use social media as a way of genuinely connecting to other people, having conversations with other people, FaceTiming and having extended conversations with others, tend to do better than those who use social media primarily to screen and scroll TikTok and Snapchat and to use it as a way of social positioning, like to measure themselves or their bodies against others. And so I think thinking about our media consumption, like how in my use of media or social media am I growing closer to actual other people that I'm in relationship with, and how much am I using this to kind of be in some ways kind of distant from other people, or to feel like I'm standing in judgment over other people. Those are all ways of distancing ourselves. And so I think our question needs to be, in the way that I use social media, in the way that I gather in church, am I being drawn to love others, the concrete others around me, or am I being somehow led to a place where I feel more isolated? And I think to the extent that the latter is the case, then that's a problem, and we can work against that.
Excellent. Thanks, Warren. Another question. Early in your talk, you mentioned how there's the very real possibility that many people who have known this period to be one of significant mental health challenges, the end of COVID, whatever that might look like and whenever that might happen, will not actually mean the end of those challenges for those people, but they will kind of continue to, and there'll be a temptation perhaps for churches, institutions to sort of to move on, not recognizing that those needs are still there. Could you speak to maybe what leaders and coworkers and neighbors, how they might sort of think about their neighbors and those whom they have been trusted to them, to be more attentive to those needs and to recognize those needs, and then perhaps like what it looks like to continue to make space for those needs in relationships and in institutions?
Yeah. Well, with respect to mental health, there are mental health issues that are specifically a result of COVID, but there's a lot of ways in which probably most of what we're seeing now pre-existed COVID, but has been made worse by it. And so therefore it's going to be there afterward, because there are many things that are at play. I think for one thing that churches can do is just to make sure that there's space to name that people are struggling, and even to name specific diagnoses. So I know that it means a lot to people. I mean, in any congregation. So imagine a sanctuary with 200 people in it. Somewhere around 40 of those 200 people will at some point in their lives have the experience of major depression. And somewhere around 10 or 15 of those 200 people will at that time, at that very point in time, be depressed. And so if they're in a church that, where it feels like you just can't be depressed, that's just not what you can do. You have to sing, and you have to, look nice, and you have to be, happy. Then people can come to church as a way to try to be near other people and to be known, but it can result in just feeling disconnected because you're like, I can't be honest about my experience. So when somebody from the pulpit or from in a Sunday school class or in a conversation just is able to just name the fact that, like, depression is a common thing and it's real and there's help, and we want to support that. Even just that can be incredibly liberating for people and can be really helpful. So I think that's one thing that is important. I think also again, it's like how to think about given that we know that all around us there are people who struggle, how would in any community we be aware if that's the case, and in our community. So I'm part of a Zoom Sunday school class at Blacknall at our church, and one of the things that we've done since the beginning of the pandemic is we've intentionally not made it something that people don't do what I just did, which is lecture for an hour. There's usually a kind of a fairly brief lesson based on scripture. Then we split into Zoom breakout rooms, and the first thing that the groups do before they start to talk about questions related to the scripture is to check in with each other. And so anybody comes to that class, I don't know if it happens in every room, but for the most part, there's always the experience of joining a breakout room and having people ask you, like, how's your week been, and how's that gone? And I've actually found that to be one of the most important communities for me over the course of the pandemic, because like every week there's people who are asking that and who are talking about their own experiences. And so in that case, like, that's been in some ways a gift of the pandemic, that I felt in some ways more connected to a certain group of people at church over the last year than I was before, because of the opportunity to know and to be known. And I think that's the thing I keep coming back to, is like, what does it mean to have spaces of genuine, healthy knowing with each other? And that was a need before the pandemic. It's a need during the pandemic, because it'll continue to be a need after the pandemic.
Excellent. Thank you, Warren. We're really grateful for your time and for everyone who's tuned in. One of the things that Warren has offered and that wants to make available to us is a chance to sort of create exactly what he just described, a chance to have a place where it can be a little bit more face-to-face interaction with him. And so I have just put in the chat a Zoom access code to do exactly that. And so this conversation will end, and then if you'll give us just a minute or two, you're free to access that and just to have some time to perhaps ask Dr. Kinghorn a question that you didn't feel comfortable typing out, or maybe something that you thought might just need a little bit more back and forth. And so in just a minute, we'll end this conversation. If you'd like to join us for that, then you can just copy that out of the chat right now, put it in your web browser and the address, and then join us for that conversation. Otherwise, Dr. Kinghorn and I can catch up and see what's happened in each of our lives over the last 15 years.
That's right. That's right.
But thank you all for joining us for this time. Thank you, Dr. Kinghorn, for your time and for your scholarship and your service to our communities and to the church as well. And we thank each of you for joining us, and hope to see a few of you guys in just a minute.
Thanks, Joey. And thanks to all of you for sticking around tonight on a nice spring night and for caring about these questions. I really, really appreciate that. Thank you. It's good to be with you.
All right. Good to be with you as well. And you are all welcome to join us for our next lecture with Dr. Patrick Smith next Wednesday as well. That information you can find at signalpres.org/CFC or also in the chat as well. So everyone have a good evening, and thank you for joining us.